So my first tip number one in my first video is the attitude, and the attitude I want to talk to you about is go for all 16. Now I know the requirement to pass the plab exam is you just need to pass 10 stations to be able to pass this exam, and my advice is go for all out, which means go for prepping yourself to be prepared to pass all 16 stations. Okay, and if you do that, passing 10 stations is going to be very easy, and I will tell you more in the next few videos in terms of how you can prep yourselves to get to pass all 16 stations. So the preparation that you should do has to be with an intention and a motivation all the time that I'm going to pass all 16 stations, and if you do that, you will end up easily passing this 10 stations. So and then I'll talk about how you can try and get to the 16 stations. So two really important aspects that will help you how to pass all 16 stations without having to go to any academy is, number one, prioritization, and then number two is actually about what are the key resources you should be using. So part one is prioritization, and part two is what are the key resources. So in this video, as I said, I'm just going to clarify that I'll do separate videos for specifically on what is prioritization, and then what are the resources, in the following videos. But right now the focus is, the mindset that you must have, that in order to pass this exam, it's not 10 stations. You got to go and get all the 16 stations. And I'm talking about only passing 16 stations. I'm not talking about getting 12 out of 12 in the 16 stations. And the reason I say that is, it does not matter what score you get in each station. What matters is you pass that station. So go for passing all 16 stations, but I'm not saying go for getting 12 out of 12 in all 16 stations, right? And if you want to get a passing score in all 16 stations, you got to complete all 16 stations, which means you got to manage your time in all those 16 stations. When I say you got to complete the station, you got to start this conversation well, the basics of the start of the conversation. You got to ask right questions to get the right history. You got to ask negative history questions. You got to ask all the other relevant history in terms of the family history, personal history, sexual history, menstrual history, pediatric history, specific history. Then you examine the patient, or you verbalize to say, I'm going to examine the patient. Then you do your management. That is what I mean completion of a station. So you focus on getting all 16 stations, passing all 16 stations, which means you focus on completing all 16 plab 2 stations. When you say completing 16 stations, you complete history, you complete examination, and you complete management. And if you do complete each of the station, and if you get the diagnosis right, you will more or less pass this station with absolute ease. Okay, that is the tip number one. Focus on passing all 16 stations. Don't focus on getting 12 out of 12 in every station. Focus on completing the station to pass that station, which means manage your time well, which means you got to make sure you get the history, you do the management, which also includes making sure you verbalize that you're going to examine the patient, and then make sure you have got sufficient time to do management and patient specific, patient focused management. What the patient wants rather than what you know is really the most important tip for passing this exam. I will stop there. So just in terms of what's coming next, I'm going to talk about the resources. I'm also going to talk about the prioritization in the next videos. Thank you.